Hello, I am Dr. Nishit Gupta. I am a consultant musculoskeletal oncosurgeon at Narayana Super Specialty Hospital, Howrah.
And I'm Dr. Sabyasachi Basu, consultant plastic and reconstructive surgeon, Narayana Super Specialty Hospital, Howrah.
So, July is celebrated as Sarcoma Awareness Month. So, that's why this video is being shot to raise awareness about sarcomas. Sarcomas are pretty rare cancers. They constitute about 2 to 3% of overall cancer burden in the country. Sarcomas are cancers which arise in bones or in the soft tissue of the body. It could be in the pelvis or other soft tissue like the fat, nerves, muscles, etc. These tumors, although pretty rare, can be treated successfully, and if timely detected and treated, can lead to a cure rate of almost 70%. Hence, it is extremely important that they have to be diagnosed early so that they can be treated correctly. Basically, in case of soft tissue sarcomas, the symptoms for the patient would be a swelling in any part of the body which is rapidly increasing in size. Because of the rapid increase in size, the patients may present with pain or difficulty in movements. When the patients are diagnosed, usually there is a lump in the corresponding tissue. Sometimes, even if the swelling has arisen in the soft tissue of the body, it can infiltrate the local neurovascular structure or the bone, causing the sarcoma to spread into the nearby structures. Very rarely, the sarcoma at presentation may have metastasized into other organs, which are most commonly being lung. In these cases, which are called as metastatic sarcomas, the treatment primarily involves systemic therapy in the form of radiation and chemotherapy, and if possible, surgery if it is required for pain relief. However, in sarcomas which are not metastasized, means they are localized to the point of origin, then the primary treatment usually consists of removal of these tumors followed by radiation therapy. In few of the entities, systemic therapy does play a role, like in synovial sarcoma, but mostly the treatment is surgical along with adjuvant radiotherapy. So Dr. Basu over here is there. He's a consultant plastic surgeon. He is going to enlighten you about what kind of reconstructive procedures can be done once a sarcoma has been excised from the extremity.
So once the oncosurgeon walks out of the OT, it's the plastic surgeon who takes charge. The cancer is out of the body. Now there is a defect. So the defect needs to be filled, otherwise there will be a large wound in the limbs or wherever. So the defect, it is essential to fill the defect. Now how do plastic surgeons fill those defects? So there are principles in plastic surgery like grafts, like flaps. So when the defect is very nominal and a graft is suitable, then we do a skin graft. We just raise a skin which can be inserted there, and that is it. Then the next step is flap. Now flap has multiple options. We can either use a local flap, that is a flap that is from a nearby tissue, or we can use a regional flap that is from another place, and it can also be a free flap. Free flap is taken from a distant source. Now what is a flap? Flap is a tissue with a blood supply along with it. Local flap, regional flap all needs proper planning. Free flap needs microvascular reconstruction, like they are taken from a different part of the body and they are inserted, they are positioned in that defect to cover the defect, and the blood vessels of the flap are then connected to the blood vessels of nearby vessels, and accordingly the defect is followed. Now the flap surgery takes a bit of time, because most commonly free flaps take a bit of time, because it requires a lot of technical skill as well as operative microscope and all other things that is required for vessel anastomosis. So that is how we reconstruct the defects.
So Dr. Basu, usually the patients frequently ask us whether they will know what kind of reconstructive procedure will be done at the time of surgery. So can you guide us through how do you plan a reconstructive procedure? What is a reconstructive ladder?
Yeah. So the first thing is to know the margins of the excision. So we ask the oncosurgeon what are the margins of the excision. Now we also try to understand what is the depth of the excision. Now if there is muscle beneath, or there is the defect is liable to be skin grafted, then we go for a skin grafting. Skin grafting is at the base of the reconstructive ladder. That is easy to do, early to do, fast, and where early rehabilitation is possible. Then we all go up to the local flap, regional flap, free flap. So it is important to know the margins, the resections, the amount of resection, and what is available nearby. If some tissue is available nearby which could be rotated, advanced or interposed into the defect, then we are done with a local flap. If not, if there is no options available, then we have to think of a free flap that is taken from a distant point. Free flaps are otherwise good, but they are time consuming and they are also technically challenging.
So Dr. Basu, another question which patients frequently ask is that many of the time these patients have been operated at some other center without any planning for the margin, and they come with either a margin positive tumor or a obvious recurrence. So the question which they ask is whether the plastic surgery will still be successful in my case, considering that I have already been operated once and the soft tissue architecture over there might not be what you consider as normal.
So there are two things to it. One is we'll have to look at the donor sites. A patient has multiple donor sites, so multiple types of flaps are possible. Then you have to look at the recipient site. If the recipient site is not suitable for a simple procedure like skin grafting, then we'll have to consider a flap. Now it is told that flap brings its own vascular supply. So even if the wound is bad, infected or otherwise, a flap which brings its own blood supply, say a free flap or a regional flap, it doesn't have a lot of problems adapting to that place because it has its own blood supply. So it depends patient to patient and defect to defect. What is the situation and what is the pre-op condition?
Another question which patients frequently ask is how soon will they be able to start the adjuvant therapy, which most often will be radiotherapy, because does it vary between the type of reconstruction which has been done, or is it the same for all type of reconstruction?
Yes. So it depends on how the wound has healed. If the wound has healed fast, radiotherapy can start fast. In skin grafting, we usually have to wait for some time before we can start radiotherapy because the skin is flimsy and it peels off easily with radiation. With flaps, it is always better that radiation can be done and it can be done early. But then sometimes wound healing, due to the malignant status of the patient, sometimes they are subjected to poor wound healing, and hence if there are small areas of raw areas or multiple suture dehiscence here and there. So in those cases, radiation will have to wait, or we have to take up some secondary procedures in which so that we can take the patient for radiation early.
Another question which patients frequently ask is what kind of care they have to take once they have undergone the surgery and completed treatment, whether it differs with the type of reconstruction?
Yes. So it depends on the type of reconstruction, obviously, because there are certain precautions to be taken in different types of flaps or whether it is grafts, and accordingly it changes from patient to patient, and those things we explain those things in detail, and how the limb is there, how it is to be kept, mobilization, how early physiotherapy can be done, and all these things.
So friends, now I think you have come to know about how we manage a soft tissue sarcoma. So basically, like any other cancer, in sarcomas being a wide spectrum of cancer, still the management principle remain the same. The treatment is via multidisciplinary approach, because although these are rare cancers, the treatment involves the involvement of oncosurgeons, oncoplastic surgeons, along with radiation oncologists and medical oncologists. A team approach is needed to devise the correct line of management so that the treatment is completed in a correct appropriate span of time and the patient is able to recover from the therapy as soon as possible. Following the completion of treatment, it is extremely important the patient does the regular follow-ups, which usually at our center we do every 4 months for the first 2 years, followed by every 6 months for the next up to 5 years, and after 5 years yearly once until 10 years, because the risk of recurrence is still there. Hence it is extremely important that the patient does follow visits. I hope this video enlightens you about the management of soft tissue sarcoma. I thank Dr. Basu
Thank you
for enlightening our audience. Thank you.